Hello, everyone, and welcome to this press conference to go over the situation of COVID-19 in Quebec. Mr. François Legault, the Premier of Quebec, is together with the Minister of Economy, Innovation, Pierre Fitzgibbon, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier. Hello and hello to everyone. I would like to start with the numbers of the past day. We have 93 new deaths, a total of 1,682. Of course, my thoughts are with all of those people and all the families and loved ones of those people who have died. We now have 25,757 confirmed cases, an increase of 775. We have 1,625 people who are being hospitalized. That is an increase of 94, and 217 people in ICU, an increase of 7. I have asked, as I had promised, the breakdown of how many people are hospitalized who should no longer be hospitalized. There were 94 yesterday. So that is to say that 94 people no longer need any hospital care, but we voluntarily kept them at the hospital rather than sending them back, for example, to the CHSLDs for the reasons that everyone is aware of. I have together with me a graph. I asked that it be prepared on the deaths. As you know, Dr. Arruda explains it quite often. There are the cases, and then the hospitalizations, the intensive care, and then the deaths. You can see that with the hospitalizations, it can fluctuate because of the situation in CHSLDs, and the cases also depend on the number of tests. So the testing, which we are increasing. So the element that is the safest, especially because we analyze it very well, is unfortunately the deaths. So I've asked for us to break down the deaths for each of the days since the very beginning, between the people who come from residences where there's long-term care given and the rest of the population. See here what you can see on the graph. The top line in blue, we can see the deaths every day. We have an average of 3 days every 3 days we remove the first day, so it allows us to have a better portrait and to remove the biases depending on, for example, the time that the information was reported, and it wasn't necessarily, a death that occurred in the past 24 hours. So what we can see, and we've said it often, is we have two worlds. Here in top blue, we have the deaths of people who received long-term care, for example, in CHSLDs. And at the bottom, the green line, you can see everybody else. So the people who are at home, who are not in residences such as CHSLDs. What we can see is first that on the green curve, which excludes CHSLDs, it's relatively low. And for 14 days, now, so for 2 weeks, the number is very stable. So there has not been any increase. It is around 8, 9, or 10 deaths per day. So it is that plateau which we've been in for about 2 weeks that is allowing us to say the situation is under control, except in CHSLDs. However, we have to go gradually in order to avoid what we want to be careful with, that there be a sudden surge in that curve. So, I'd like to come back to the daily announcement. Yesterday, we announced to you that we would be gradually reopening the primary schools and daycare centers, but that we would be keeping high schools closed until the 1st of September. Today, what we are announcing is that some businesses will be reopened throughout May, so gradually over the following weeks. And I will let Pierre give you details. But I would like to tell you that that work, first of all, was done, and it was a lot of work, and I wish to thank them. There are 4 groups that work together. So there is the team of the economy minister, there's the public health team, There is Jean Boulet's team, so the employment minister, and the people from the Commission of Health and Safety at Work, to make sure that all the measures that had to be taken will be in guidebooks and others that will be presented by Pierre and Jean Boulet. So it's important to say so. What we are presenting to you right now, this plan, is the result of a consultation between these 4 different groups. So throughout the month of May, there will be 3 broader types of businesses that will be reopening. First, the stores that are not in shopping malls, or that are in a shopping mall but with a door that leads directly outside. So in the short term, we do not wish to reopen shopping malls and have the risk of having gatherings in shopping malls. The second sector is the entire construction and civil engineering, so road work, construction for infrastructure. So that is the second large group. And the third are the manufacturing enterprises and corporations, so plants. These are the 3 groups that will be opening gradually over the following weeks throughout the month of May. The idea here is to reopen gradually and to have a follow-up to see, is there an impact on contagion? Is there an impact on the situation in our hospitals? Excuse me. So it is important that we keep control. So that is why we're only opening a part of businesses, and that we will be doing it gradually over the course of the following weeks throughout the month of May. I'd like to come back to the guidelines because there are certain people who might think that because we are reopening schools, some schools or certain businesses, that everything is allowed and it's a free-for-all. No. We have to get used to, and to get used to this for a long time, to keep, for example, the 2 meters or 6 feet of distance with all other people, and of not having any gatherings. So we do not want for groups of people outside or inside get together. And I know that it can be annoying to always talk about people who are older, and everything is relative, and now we're talking about the people who are 60 and over. So I'm included in that since I'm 62. So I don't like it any more than anybody else does, you know. But it remains that, as we keep saying, the numbers and the facts are very stubborn. 97% of the deaths that we've had in Quebec since the beginning are of people who are 60 and over. The youngest ones are often people who had chronic diseases, so who were more vulnerable. So the people who are vulnerable, and in particular all those people who are 60 and over, it's really important to keep that distance of 2 meters with all other people, whether you're at home or outside. And I should say, because we, the people 60 and over, we learned that in feet, so it's 6 feet, so you always have to stay 6 feet away from anybody else, always 6 feet away, even from your own children. Stay 6 feet away. We have to act as if everybody that you met had the virus and you didn't want to catch it. So you have to act prudently, and in this way we'll be able to gradually go back to a normal life. I would like to end with my daily thanks. My daily thanks are for entrepreneurs of Quebec. The people who know me know that I love entrepreneurs. These are people who are creative, who take risks, who are ahead of the parade. And I know that these weeks have been horrendous. It's been hell financially. And I also know that tomorrow morning is not when you're going to be able to find all your clients again. So I understand how stressful it is. Entrepreneurs who have built an enterprise, a business during their entire lives, and now they end up with something that they have a lot of difficulties with financially. And it's not their fault. It's not because they made bad decisions. It's really something that fell on our heads with COVID-19. So I wish to tell you Pierre and other people from the economy sector are there to help you. So whether it be Investissement Québec or whether it be your own bank or your own caisse, there are links between the banks and the caisse and Investissement Québec and the Ministry of the Economy. We need our entrepreneurs, so we're going to do everything to help you financially to get through. It's to the advantage of the entire society to do so. And there are programs that have already been announced, and we will continue announcing programs over the next few weeks and months. Our society needs those entrepreneurs. So I want to tell you to end with two entrepreneurs, courage. Together, we are going to get through it all. Thank you. In English now.
Good afternoon. Today, we announce our plan to gradually reopen our businesses. It's the product of the collaboration between the Minister of Economy, Minister of Labor, the CNE-SST, and the public health authorities. Our challenge is to gradually restart the economy without restarting the pandemic. The reopening will be spread through several weeks. We only announced the first part of it today. We'll start with businesses that are not in shopping malls or that have a door that gives on the outside. We'll also start reopening our civil engineering construction, road construction, and factories. We will later announce a plan for other businesses. The idea is to gradually add workers and analyze the effect on the contagion. But one thing is clear, if we want our plan to work, we need to continue all our efforts of physical distanciation. And we need to continue to protect the most vulnerable. I'm counting on you all. Thank you. Je passe maintenant la parole au ministre de l'Économie.
And now the Minister of the Economy, Pierre Fitzgibbon. Thank you, Mr. Legault and Dr. Ruda. Hello, everyone. We are evaluating that right now about 1.2 million Quebecers are in temporary work stoppage because of the confinement measures that have been set up to stop the spread of the coronavirus. Putting Quebec on pause was not an easy decision to make. The situation, however, is stabilizing in the vast majority of the regions of Quebec, and we have obtained the authority or the permission from the public health authorities to reopen our economy slowly and gradually. I wish to clarify that the public health authorities, as well as the CNE-SST, have elaborated very clear rules that all authorized businesses will have to respect at all times, the ones that are authorized to open. The guides are available, and the guidelines are available on the website of the CNE-SST. For construction, it's already there, and later today for those businesses and manufacturing plants and factories. As the Premier is saying, our reopening plan will be progressive and will be done over many phases. We will not hesitate to and take a step back if ever there's a new breakout of the virus, which is not something that we wish for, of course. To limit the risk, we prioritize first the reopening of 3 sectors of activities that have an important impact on the economy: construction, retail, and manufacturing. Press releases will be emitted over the next few minutes on these reopenings. So first, for retail, everywhere in Quebec, except in the metropolitan area of Montreal, the CMM, retail stores that have a direct exit outside will be able to reopen as of Monday, the 4th of May. For the Montreal area, it will be a week later, that is the 11th of May. However, shopping malls with common areas will have to remain closed until further notice. As far as the supply chain of what we call retail, so they will be able to take up their activities on the same dates, the 4th or the 11th of May. The reopening of stores and of their respective supply chains will allow 196,000 Quebecers to go back to work. And all those businesses, of course, are going to have to set up the necessary protective measures for their employees as well as their clients. Secondly, for the manufacturing sector, the reopening will be done in 2 stages to ease the respect of the sanitary health rules. The Monday 11th of May, manufacturing companies of all regions of Quebec, including the Montreal area, will be able to start again with their activities. However, there will be one restriction as far as the number of employees that can work at the same time. For each shift, the working of companies will be assured by a maximum of 50 workers plus 50% of the employees that are above 50 per work shift, and that at any time of the day. I'm giving you 2 examples. A manufacturing site that has 50 people or less during the same work shift can work at its full capacity, whereas a manufacturing plant that employs 500 people during the same work shift can only work with a function with a maximum of 275 people, being the 50 plus half of the excess, which is 225, total 275. The reason is easy. The reason is easy to understand. We want to ease the possibility of social distancing between employees. And then if everything goes well, all manufacturing plants of all regions of Quebec will be able to go back to their activities with no restrictions on the number of employees as of Monday, the 25th of May. That would be 2 weeks later. So that is over 176,000 Quebecers that will go back to work with these measures. Moreover, all employees of manufacturing plants or all sectors that can do working from home will have to continue doing it, which will allow to minimize the spread of the virus and also inserts itself very well in a concept of initiative of respect of the issue of climate change. The world in which we live is certainly going to change, whether we think about the evolution of e-commerce and the way that we move ourselves around. As far as construction, my colleague Jean Boulet, Minister of Labour, through a communiqué, is confirming the complete reopening of the construction industry as of the 11th of May 2020. This decision, supported by the public health authorities, is also subject to be changed depending on the evolution of the health situation in Quebec. This reopening will allow close to 85,000 workers to get back to work. Construction sites will therefore start in all sectors of construction, which will bring the reopening, full reopening of the supply chain of the construction sector, which includes many SMEs. And we prolong until the 31st of May the closure on Sundays of all retail stores except pharmacies, DEBs, restaurants, and grocery stores with certain restrictions and permissions. By opening our economy progressively, public health is going to be able to measure the evolution of the virus in Quebec. We are confident that the gradual reopening will be able to continue, but we will adjust ourselves as needed. Thank you to you both. So for the question period, we will start today with Patrick Belrose. A question for Mr. Legault and Arruda. After the WHO and the federal government, we see that the collective immunity strategy is being rejected. Do you still support this strategy, and on which scientific basis do you base yourself? Well, perhaps I can say that we do not support that basis. We're saying that it's a possibility, but we don't have any evidence that it works. So, as I explained yesterday for the reopening of the schools, the criteria that we followed to reopen the schools did not include herd immunity. So I don't quite see a big difference between what we're saying and what the Institute is saying. Yes, and if you will allow me, the minister was very clear on the 5 reasons that we base ourselves on to reopen the schools. There's not just infectious diseases, there's also all the social problems. I was questioning, and I'd like to say that sometimes there's an interpretation in what we say where our position is opposed to that of the WHO or Canada, but we're on the same wavelength. in the facts. You know, we're told to be prudent. That's what we're doing. The Minister for the Economy himself says that it will be monitored very closely. This is a plan. We're announcing dates so that people can start getting themselves ready. But we will be evaluating the situation. We're going to be applying the same criteria that are recommended by the WHO in terms of feasibility, hospital capacity, screening tests, and all that. So when the Institute tells us that the question of herd immunity is not an element, well, I mean, everybody dreams of a virus that gives collective immunity because we don't have a vaccine, and we're not going to have a vaccine for a long time, and we don't have treatment either, and we know that we won't be able to stay confined. And the last message that I want to repeat, you have to look at the development of our economy right now, the openings, like essential workers that are reopening right now. You can't see it as being a message to everyone that here we are, they're going out, so I can go out. Because the success of this operation is going to depend on the fact that the transmission doesn't start. And people are going to reopen. It's not going to be the same plants anymore. It's not going to be the same stores. It's not going to be the same anything, the same environments like before. Now, social distancing is going to be part of it. People who will not respect that are going to have fines. And I would ask the population to collaborate and to be prudent so that in our community we don't see a surge, not because of the reopening, but because people started gathering and started having parties and exposed our elderly, who for us are important. If we do this, it's not for the fun of locking them up. It's not for the fun of, to be vengeful of what they did when we were little. That's not at all. It's not, it's because these people might end up in intensive care and might die, unfortunately, because circulation now is going to increase in the population, of course, with more people who are going to be in contact, etc. So that's important. And I wanted to clarify these elements because very often we're put into opposition in terms of interpretation. When I talked about herd immunity, it's because I had a question from you asking me what was the level of collective immunity that we'd like to see if we were to have mass immunity. It was that. It was a theoretical thing. It's unfortunate, but this virus is quite treacherous. It infiltrates us. We're still learning about it every day, and we're not done. But we cannot either remain locked up forevermore. Monsieur Legault, why not allow small gatherings in private homes? For example, dinners amongst friends or children who might play together with the neighbors' kids on their backyard. Are those people going to get fines if you end up 4 or 6 people in a residence or in a terrace? Well, nothing has changed as far as gatherings is concerned. As Dr. Arruda said, businesses, we can't close them forever. We need having income to be able to get services. So that is why we're going gradually. But having parties, dinner parties, family parties, well, this is something that we could avoid doing for a long time. I understand that it might not be good for mental health, and people are looking forward to seeing one another again. But first, people have to stay 2 meters away, and ideally not be too long in the same room, even if they are 2 meters away. So if we want to save, if we want to be able to really save those vulnerable people, we have to maintain those guidelines. We have to understand that the main driver of the epidemic is not necessarily the context that we have in a society where we just, see one another for a second. But it was family contacts, like in China. That is the greatest risk of transmission. That is why we want to not allow it. Clearly, with the evolution of the situation, we'll see when we can allow progressive gatherings. It's the theme of the day, the word progressive, depending on the epidemiology, which will be different from one territory to another, but it is much too early yet to be able to do so. Tamish Wina from La Presse. Hello, Mr. Premier. Your counterpart in Ontario has just declared that there's no question of following the example of Quebec about the reopening of schools. And he declared we do not want to put our children in danger. Do you fear that you're underestimating the risk to children going back to school? No, I find that if we're talking about children that have a hard time learning, for example, it's a question of balancing out the inconveniences. There's a lot more risk of, preventing them from going to school for 6 months than the risk of having serious consequences of going back to school. So it's a question of evaluating things and the risks. Nothing is perfect. Nothing is 100% certain in life. But we are calculating together with public health that it is better for those children to go back to school. And if you allow me, Mr. Premier, in the connection of Australia, a media newspaper, they're talking about the most recent data together with transmission in children. First, children are rarely ill in a significant way. It doesn't mean that there's no cases that are possible, but they are not very ill. And unlike what we thought in terms of influenza, where they become great vectors of transmission within the population, it does not seem to be the case. We still had to be prudent, and that is why we're not sending everybody, together, the children all together, and that we are still going to place distancing. But I do not think that we are putting the children at risk. Rather, we are allowing certain more vulnerable children to have access to food, to education, to make sure that there's not educational delay that will be done later, and that we have a whole series of young people who won't be able to finish schooling because they'll have a hard time getting through high school, for example. Dr. Arruda, I think that a lot of Quebecers don't understand the advice of public health about this deconfinement plan. To understand correctly, on a scale of 1 to 10, where is the risk that this deconfinement plan will mean that there will be a surge of transmission in adults and an increase in hospitalizations? It is clear that there will be an increase of transmission in the community as soon as we open up a little bit, and that there could even be people who may die. Now, the gradual reopening wants to minimize that element. There is nobody who is going to tell you that there will be no case of transmission. We know that there will be some. But it's not by locking people up forever, where people could revolt and start getting gatherings at home, et cetera, where there's going to be even more cases. It's what we call a weighted risk, and that is going to be followed regularly. We will have a possibility of keeping an eye on things, and I've said it, the Premier knows, and the Minister Fitzgibbon knows. We will go back if we think that we're going too quickly. We'll go back, and I would tell you that if the population does not follow the guidelines as such, I will recommend the confinement, a very important one, without hesitating, so that we don't have to end up in a situation where we have to choose between Mr. X and Mr. Y, or Madam X and Mrs. Y, to save them. But, as I was saying, there will be cases. Yes, I can tell you that for 100% there will be more cases. But will these cases be uncontrollable? The answer to that is no. And don't forget one thing. We're not asking people who are at risk to deconfine themselves or to go to work. We are taking those people who are perhaps going to catch it, but who are going to have very little impact on their lives. Some of them might not have symptoms at all. Some might need hospitalization. I hope that not too many people will die, because I want us to be clear. The virus is here. And the virus is going to be here for a long time. We could decide to go back and wait for September and at the same time as the flu, which to me is not a very good idea. But each government is looking at its local epidemiology. We are deconfining in the regions that we call code regions compared to the hot regions. And it was very well said by all the international recommendations that we have to look at the local epidemiology to be able to make those decisions. So I think that in Quebec, we are able to do so. We know that it's a risk. We cannot eliminate the virus. It is circulating. The question is, how do we do it? How do we balance things out? And I want to say that the economy, money, mental health, everything that we call in a society, it's not just infectious diseases, but all those other things are determinants of health. We want to avoid suicides in SME owners, divorces because things are going badly, and, violence against children. That's also part of social health that we have to be able to measure.
Ministre Fitzgibbon, Dr. Arruda.
Where are you at in your considerations? Because just to set the table, we understand that there will be no traveling this year. or the summer. It's going to be beautiful. People are going to be on vacation. But where are you at in your prognostics to open, for example, regions, like campgrounds, parks, the fishing industry, restoration, the entire tourist industry, basically? Are we going to have a tourist industry this summer? When do you see that reopening happening? We don't know yet. We are continuing to evaluate the situation. We are starting with what we're announcing today, but for everything else, we have not chosen to open up, restaurants or campgrounds. No, the campgrounds, hold on a second. Yes, in certain cases, it could be reopened. People who live in Florida, for example, in the winter, and they live on a campground in the summer, as long as certain guidelines are respected. But generally speaking, when there are gatherings, whether they be in a restaurant, whether they be in a showroom, we're not there yet. For the time being, we believe that it is not a good idea to reopen in the foreseeable future. For campgrounds, therefore, it's only for people who come back from Florida? I'd have to check. But if there are criteria that are followed, guidelines, people, there are some who live in a camper, like as if they were living in a home. So we have to be prudent. As long as you maintain the 2 meters, I think that it would be okay. Now, for the elderly, many people are writing to me saying that with the rule, for example, people who are in residences for the elderly, for autonomous residency, can't circulate, they can't go out, they can't leave their residence except perhaps to just go in the back yard. And other people are telling me, well, we can go out because we have our home. So we can go for a walk, we can have a certain level of freedom of movement. But it's not the case for people who live in residences for the elderly. Isn't there a kind of discrimination here? Don't we have like 2 different classes? No, I think it's a question of common sense. We know that in our CHSLDs and in certain RPAs, residences for elderly people, there is contagion. And there is a situation as well which was very difficult. A lot of people were contaminated. We want to avoid that people continue increasing the number of infected people, either in the residences where there's already infection or in those residences that have no cases, and it's a majority of them. So it has to be understood that the risk is greater in a residence rather than somebody who lives alone in their home. So that's why we are very prudent of not taking the risk that people walk around, do not respect the 2-meter distance and bring that back to the residence and contaminate tens of other residents. So it's a question of common sense. I'd like to mention that time is going by very quickly. Next question. Dr. Arruda, thank you for having supplied the data concerning the deaths in CHSLDs yesterday as well as today's curve. What we can see, however, is that since there were like 2 peaks, have we reached the maximum peak, or are we thinking that there's more to come? Listen, all of this will depend on the evolution and how people will be behaving, if you'll allow me to say so. We saw the first peak that might correspond, and this is hypothesis. I'd have to have very fine analyses on all the causes of each of the cases that we had. But it's probably what happened with the traveling at the beginning, like the people who traveled, people who came from the outside, etc. And after that, there's the drama of the CHSLDs on top of it all. So we can see the very significant increase. What we want to avoid is to have the big peaks. What we want to avoid is a curve that starts doing this again. You understand? We want the curve, it's going to increase, of course, if we're opening up circulation. But what we want to do is to maintain it flattened to a low enough level to not overload our healthcare system and to avoid an amplification. That is why it's so important that everybody keeps doing their share to avoid some amount of small epidemics which can become large epidemics. But it's clear that if ever in a manufacturing plant, if there's an epidemic, we will intervene, we will contain, we will cease operations, we'll make sure that the families of those people are not ill, and all that. All that will be maintained to avoid the curve going back up significantly. And we will, of course, test, and test to see how the population is moving through the population, even probably people who are asymptomatic. There will be samples done. And I just want to be very clear, Mr. Bergeron, the idea of the graph was to look at the situation elsewhere than in CHSLDs. So I draw no conclusions on the situation in CHSLDs, and that is why we are not modifying the guidelines in CHSLDs, and that is why, for example, we don't want people to continue going out. The purpose was to say in the rest of society, it's been 14 days that we've reached a plateau, that we have not had increases in the number of deaths. Therefore, in the rest of society, we can gradually reopen schools and businesses. But CHSLDs, I don't think that we are able to say, well, we've reached the peak here. We know that there's still a lot of infected people in CHSLDs. Now, you talked about it yesterday. You touched upon it. You said that you could go up to close down a business that does not respect the guidelines for social distancing. Now, we've learned that a guidebook has been set up. But what will the sanctions be? Well, I don't know the details. It's the SNEST, the Commission for Health and Equity and Social. Sorry, I'm old. We just called it the CCSST before. It shows how old I am. I'm not used to the merger. But anyway, it will be associated to the fault gradient. And I think that you have to understand that there's the employer who has obligations, but the employees as well. They also have to make sure that they have to ensure the safety of the people that they work with. For example, if within their work they need to get closer, less than 2 meters away, we recommend that they wear a mask. So, this is collective work. That's what that means. And those things have been done, in a paritary way with the unions and with the employers. And I think, honestly, that there's always exceptions. In a society, there's always exceptions, but I believe that entrepreneurs are very conscious of that. There are people who are going to work a lot more from home, so I think that we're just going to have a new way of working, and I think that the world will never be the same again. As such, let's hope that we are not, stuck at home for an eternity, but we will have learned a lot of things. And, working from home will have an effect on transportation and all that. So people have an advantage to do it adequately. Not just the big companies, but the little ones. So it's not time, in a store of beautiful stores, beautiful flowery dresses, to be 40 people trying them out in a small space. I hope that people will understand that the population will also require that things be done adequately. Mr. Legault, how much do you think that have been the expenses of the state? I know it's very broad, and it's mainly Mr. Girard who has that information, perhaps more, but where are we at? Well, listen, we are at this stage. We have too many estimates to try publishing numbers. Yesterday, I had a meeting with Mr. Girard to talk about it, to see what the evolution of the situation is. We are working on it to be able to answer you within a few months. And my other question is, where are you at, perhaps with public health, now that we are at deconfinement, on the tracing on cell phones, following people who are ill to know whether they are following the guidelines or not? Okay, first I want to be very clear. There will be protection of personal data. If ever we were to use that data, it would be with the agreement of the people concerned. So it would be for their own good and with their agreement. But we are not yet at the stage of saying whether we're going to use those means or not.
Prochaine question, Alain Laforêt, TVA Nouvelle.
Bonjour, Monsieur le Premier ministre, Monsieur le ministre, Dr. Arruda. Ma question est pour vous, Dr.
My question is for you, Dr. Arruda. We understand that you are in full agreement with the decision of opening up businesses and schools, but what for you is the breaking point where we'll have to take a step back? Well, yes, I agree, because as I told you, there's reasons others than just infectious diseases, and we believe that the people to whom we're asking to go to work are people who are at lower risk than others. The breaking point will come when we are, first, having community transmission that is so high that we'll have hospitalizations that will surge. significantly. So it will be the rhythm of hospitalization, the rhythm of increase of cases, the proportion of cases that are symptomatic compared to the ones that are symptom-free, and also checking the hospitalization rates, the use of ICU, and the loss of control, I would tell you, of the outbreaks that may take place in the different working environments. There's going to be outbreaks. There will be an increase in cases. But as I told you, as long as we are in a flattened curve and that we are under control and that we can also measure the effect of deconfinement in terms of proportion of people who test positive in the population, those are all indicators that we will be using. And that will be done on a daily basis. We also have scenarios. It was published at the Institute, a modeling from Mr. Preston that is going to be updated regularly. This is not something that is done in one day. It takes those supercomputers working 24 hours a day all over Canada. But we will be making decisions based on that. And it's clear, it's quite clear that there is nothing that will prevent me from emitting a recommendation of stepping back if necessary. And I sincerely hope that we will be able to do this adequately. And there are also possibilities, which is to, postpone or to spread out certain things. We announced 19th of May, and maybe it won't be the 19th of May, maybe it'll be a week later, depending on the indications that we see and that the criteria that we've set for ourselves are respected. My question is for the Minister of Economy. We know that right now there are 300 inspectors for the surveillance of construction sites, road construction, residential, infrastructure. What are the measures that you will set up to check what's going on in businesses? Okay, well, first, we work very hard with the CNESST, the guides that have been set up at Public Health and the work group with Mr. Boulet are very firm. Businesses are going to receive the guide. Some have even received it before. There are 15 associations of businesses with whom I've been working for 3 weeks. They are expecting it and they realize it, that they have a level of civil duty, and many are even already ready. So I think that we have manufacturing sector is ready and their clean standard is already very high. Many companies have branches outside of Quebec. I'm thinking, for example, in the aerospatial domain, where they have very high standards, and I'm very comfortable. I know that the guidelines will be respected, but ultimately, employees have to be, have to feel comfortable working. So concerning the economic activities, yesterday for education it was very clear that it was voluntary. So only the children or the parents who wanted to send their children could do so. But is this mandatory? People who say, "Oh, I'm worried for my health. I don't want to stay. I want to stay home and just get the money from the federal government." Is that person forced to go work, or can their employers have recourses against them? Is that all done on a voluntary basis? And concerning the federal emergency monies, there's been critics lately. Do you think that it might discourage certain people from going back to work? Well, first, I think that I would answer that there are jurisdictions, for example, in Ontario, where they never close, the manufacturing, except that they're still closed, right? So it's clear for me that even in the economy, we work with Mr. Boulet in Public Health, we had to find a protocol that would make employees comfortable. And I think we found it. The guide is very well done. I looked at it. There are companies that have looked at it as well. So I believe that when we announce over the next few days what the protocols are, the employees, in most cases, I think are going to be comfortable going back to work. And of course, there's important pressure on companies. Now, can employees decide not to go? That's something else. But since we're working on a progression, we're talking about 50 employees plus. So there's a sequence that will allow people to have a look at that. And secondly, we're talking about the 11th of May. So that's not tomorrow morning. So it's the entire question of information, education that we have to do with people. What we have to do. We have time ahead of us. So I'm very comfortable that we'll convince the employees that it is safe. Concerning the professional health services, dentists, optometrists, a lot of people are worried, Do you have a sequence, a horizon for those kinds of services, which in certain cases are, essential? Well, we have a complete list of all the services that are offered, and we have decided at Public Health to choose these three sectors. We're talking about 500,000 people who could go back to work out of 1.2 million that have stopped work. We have to go, in sequence, and we're going to work with other ministries, culture, tourism. We're looking at possible progression, but right now we are limiting ourselves to these three sectors because otherwise it's going to be too many people, too quickly, and Dr. Arruda will be unhappy.
La prochaine question nous provient de Mylène Crête du journal Le Devoir. On apprend de nouvelles.
We are learning new information on the coronavirus, that it could cause blood clots that could be transmitted by ventilation systems. In light of this information, how can you ensure to all Quebecers that going back to work is safe? Well, listen, there's all sorts of things that are emerging, even on the clinical domain, etc., but it remains, once again, I don't want to use the term driver, but the main transmission factor still remains transmission through droplets, etc. So I think that there are rare phenomena that could exist, but I do not believe that it is significant to prevent, I would say, the transmission or prevent people being able to function once again. Very well. Following question. To you as well, Dr. Arruda, do you have any reticence whatsoever with this reopening plans for schools and the economy? And if you do, would you say so to the media? My reticence is not knowing what is really going to happen and how it will unfold. But I can tell you that the guidelines have been clearly established. The work has been done so that this reopening is not at all done the way we used to function. So we have respected, I would say, what is recommended, everywhere, even in Canada. I think that, I don't know if people have the same interpretation, but I think we're saying the same thing. What is going to change things is the compliance people. So the compliance that people follow, what the population is going to do at work and elsewhere. And we don't want to be a dictatorship. We don't want to prevent people from living. That's not it at all. I am myself a guy who's really looking forward to going in my RV and camping, 2 meters away from anybody else. But we all need that as individuals. But I do believe that we cannot either stay like this until September. In my opinion, we'll have as many perverse effects, and maybe we'll have, a calm for the summer season, which will be an element. So I am comfortable, but with the condition that it's going to have to be reevaluated every single day. Very well. That completes the French questions.
In English, we'll start with Katsani, CBC News.
Okay, good afternoon. You know that the federal and Canadian provinces are watching you with yesterday's announcement and today's announcements. So given that Quebec has so many COVID-19 cases and deaths, how can you justify reopening the economy with the virus that is still spreading?
Okay. First, we have to be very careful when we compare figures between provinces because we don't declare that the same way. Second, we have a very specific problem with the long-term care residences. So that's why what I showed, and maybe I can explain it in English, when you look at the death every day since the beginning, upside you have the number of deaths in residences, and downside in green, you have the number of deaths in the population in general, outside of residences. And we can see that the one in green, for the last 2 weeks, there was no increase, and it's relatively low. Even if you compare with Ontario, for example, it's very low. So we think that in the population in general, it's quite under control. So we'll gradually open schools and companies, but we want to make sure that the number of death and the situation in the population in general keeps being under control.
Second question.
Yes, my second question is for Mr. Fitzgibbon regarding your plan today. We saw an outbreak in a greenhouse in Ontario not a long time ago, and then we saw like a Cargill meat packing plant be in front of an outbreak. The pressure now is on businesses, is on construction sites, stores, that they have to put in place measures. What are your expectations regarding this, about how you want the working place to change?
Well, first of all, I think despite other jurisdiction, we have been very severe by closing manufacturing, for example, while other places, France and Ontario, have kept manufacturing open, but in fact, de facto didn't operate. The primary reason is the employees. I think it's very important that employees come to work and realize this is not the same place it was before the COVID-19. And frankly, over the last few weeks, between the CNEA-SST, between public health, there's been a lot done to develop protocol. And I think the next few days, these protocol will be explained to employees. The employers know what they have to do. And I think that the proper information that will be provided to the employees will make it that people will feel safe to go and work. We're progressing, making a sequential opening of manufacturing, 50 employees per staff of the excess, May 11th, May 25th, the retailers in the Montreal community is going to be later. So I think we're doing everything fine, everything appropriate, I believe, to secure people. Because if employees are not secured, they're not going to go to work. I'm not going to force them to do. But I think our approach is sound.
Thank you. Samuel Pouliot, CTV News.
Hi. Mr. Legault, many teachers point out that without full enrollment, they won't be able to teach new material to students because those who stay at home will fall behind. They say this is more about getting parents back to work than kids back to school. How do you respond to that?
Yeah, I think it's important for our children that they go back to school, especially the ones needing special services, the ones having learning difficulties. I think it would be a very bad idea because they got out 2 months ago or about a month and a half. So if you go to September, it means 6 months without going to school. I think it wouldn't be good for children having difficulties, and it represents 20 to 25% of our children. So it's very important, and that's mainly for them that we took this decision.
And about the CHSLD, do you have a timetable for when medical specialists will no longer be needed in CHSLD?
Okay, I think that we already have a lot less doctors in our CHSLD. I think that it's something like 150. So we have a lot less. Some may come on a partial time, but we already have less physicians in our CHSLD than a week ago.
Thank you. The next question is from Phil Autier, Montreal Gazette. It's for Mr. Arruda. Yesterday, you said Quebec will greatly increase testing for COVID-19. We are hearing from teachers and students who are scared of returning to school. Do you plan to test teachers and staff and children before they return to the classroom environment? That seems a wise idea.
Yes, in fact, it's clear we have actually capacity that is not used as it could be, and it's going to be changing this week. We're going to give even more access to tests to different kinds of population, and the ones that are going to open are going to be tested. On the case of an outbreak, but also to document the situation.
The next question, as a second question, is for Mr. Legault. Now that you are talking about reopening the economy, is it safe to say the worst of the coronavirus outbreak is nearly over for Quebec? How would you describe the state of the Montreal economy?
Of the economy?
Yeah, Montreal.
I'll add that to Pierre about the economy. But regarding the situation of the COVID-19, I think it's under control, except for the situation in CHSLD. But we have to be careful, so that's why we are reopening some schools and some companies very gradually. So we want to make sure that we don't have a second wave coming. Regarding the state of the economy, it's very tough, especially in Montreal. So maybe you can add a few words.
Yeah, basically, Montreal has been shut down to a large extent other than essential services. And that's one of the reasons we want to progressively reopen. Of course, we need to be sensitive to the public health situation, but there's a balance that I think we're trying to put together. And I'm very happy about the work that we did with public health. So I'm hopeful that the sooner we restart the economy, the sooner we'll be back to where we were back in December 2019, which is obviously a million-dollar question.
Thank you. The next question is from Raquel Fletcher, Global News. Can you explain your strategy for testing and contact tracing? Yesterday, Dr. Arruda mentioned that 15,000 tests per day are done. That doesn't seem like enough given hundreds of thousands of people will be going back to work and school at once.
It's clear that we never test, I would say, everybody. We always go by, I would say, échantillon, which means a specific quantity to try to extrapolate the data. But I can tell you that the capacity that we have now is going to be going very almost more than what is done in Canada actually soon. So I've got the confirmation with the ones who are responsible for that we're going to have a big capacity going up to high levels, I would say, soon because of new technologies coming soon and new contracts also with companies who are doing the tests.
Thank you. And as a very last question, when you see Ontario is keeping schools closed until at least June, and Justin Trudeau is also being very hesitant about announcing any reopening of the economy just yet, do you not think Quebec is opening too soon?
Well, again, I'll repeat what I said. If you exclude cases coming from the CHSLD, long-term care residences, our situation in Quebec is under control, and there's a very low number of cases and death. So, and also our number of people in hospitals is also under control. So, I don't know exactly what's the situation in Ontario, but our situation is under control, except for long-term care.
Thank you. So that's it for today. C'est ce qui complète pour cette conférence de...
That puts an end to this press conference for today. For the test, could you repeat this in English or in French?